Childbirth could kill, but ancient women rarely faced it alone. When contractions began in an Egyptian town, a Greek household, or a Roman apartment, the first person called was usually not a physician. The room might be private, crowded, and lit only by daylight or oil lamps. It was a woman with practiced hands, a midwife, relative, neighbor, or older mother who had seen birth before. She brought knowledge, a few simple supplies, and perhaps most important, other people. That does not mean ancient childbirth was safe. There were no antibiotics, blood transfusions, reliable anesthesia, or a cesarean operation that a living mother could reasonably expect to survive. Yet the familiar picture of a terrified woman abandoned on a cave floor is also wrong. Ancient evidence is incomplete and heavily favors Egypt, Greece, and Rome, but what survives reveals a system built from experience, cooperation, ritual, and luck. Most surviving accounts were written by elite men, while the women doing the work often left no words of their own. The danger began with the human body itself. A baby's head and shoulders are large compared with the opening they must pass through, and the birth canal changes direction instead of forming a straight tunnel. During a typical birth, the baby must turn while descending, then rotate again as the shoulders follow. The head normally enters one way and emerges facing another, a sequence no observer needed a medical degree to recognize. That choreography works remarkably often, but a small mismatch in position, pelvic shape, or fetal size can stop it. Researchers still debate exactly how walking upright, brain growth, metabolism, and pelvic support shape this problem, so there is no single neat evolutionary culprit. What matters in the birth room is simpler. Human delivery is unusually demanding, and assistance can make it safer. A helper can steady a squatting mother, watch the baby's position, notice when progress has stopped, and receive a newborn who arrives facing away from the mother's hands. The central technology of ancient childbirth was therefore not a tool. It was the midwife. Her education usually passed from woman to woman through observation and repeated practice, which leaves almost no archaeological footprint. Written sources show that some became recognized professionals. In the 2nd century CE, the physician Cyrannus described an ideal midwife as literate, calm in danger, physically capable, experienced in treatment, and able to reassure her patient. He also wanted short nails and soft hands, a detail that sounds less dramatic than a bronze instrument until you remember where those hands had to go. His description was an ideal, not a census. A wealthy Roman might summon a trained obstetrix with assistants, while a poor, rural woman might rely on a relative whose training consisted of many births and a very good memory. She might have learned from her own mother, then refined that knowledge across decades. Skill varied, access varied, and survival often depended on who could reach the room in time. Once labor looked real, the birth team prepared an ordinary domestic room, not a hospital. Cyrannus listed warm water, oil, clean wool, soft cloths, bandages, sponges, and things to revive a fainting woman. The list is striking because most of it is not magical, and none of it requires a machine. Water washed, oil-reduced friction, cloth-absorbed fluid, and extra hand supported a body exhausted by hours of contractions. The room also needed light, space around the mother, and a surface where supplies could be reached quickly. Someone kept the fire and water ready while someone else carried messages. The helpers also had to prepare for waiting. Labor could begin, slow down, and begin again, while everyone watched for the moment when effort became danger. There was no monitor drawing a reassuring zigzag across a screen. The monitor was a midwife's eyes, ears, fingers, and memory. Her information was limited, but it was not nothing, and generations of repeated births had turned patterns into practical rules. Ancient mothers were also not automatically flat on their backs. Across many societies, women labored standing, kneeling, squatting, or sitting upright, changing position as their bodies demanded. In Egypt, texts and images connect delivery with special bricks placed beneath a squatting woman. One painted mud brick found at South Abydos dating to roughly 1750 to 1700 BCE shows a mother and newborn assisted by two figures. In the Greek and Roman world, a sturdy birth chair could provide a seat with an opening, a back, and grips for the mother's hands. These supports also gave assistants room to reach the baby, while others steadied the mother's shoulders and arms. If no chair was available, Cyrannus said she could sit on another woman's lap. Gravity and movement may have helped comfort and descent. But ancient people did not run clinical trials on their furniture. The honest conclusion is not that one posture always saved lives. It is that women used several positions, and the modern delivery bed was not the timeless default. Pain relief was practical, social, and limited. A midwife might massage the abdomen or lower back, apply warm cloths, use oil, encourage movement, or guide the mother through the rhythm of pushing and rest. Serranus repeatedly valued calm and reassurance, which mattered in a room where fear could tighten every muscle. Ancient medical texts also name herbs, wine, fumes, and mixtures for women's problems, but identifying the plants is difficult. Dosage is often unclear, and some ingredients were useless or dangerous. There was no dependable epidural hiding in a clay jar. For most women, the strongest relief came from touch, warmth, position, familiar voices, and the knowledge that someone competent was watching. Simple comfort could make a long labor more bearable, but comfort was not the same as medical rescue. None of that could erase severe labor pain. The difference became brutal when pain signaled obstruction instead of progress. It could, however, prevent panic, conserve strength, and help a woman continue through a normal birth. Beside the water and cloth sat another kind of protection, the supernatural kind. Egyptian families used amulets and images of deities such as Tauret, a fierce, pregnant hippopotamus goddess associated with childbirth and protection. Bes, small, wild-faced, and armed with enough attitude to frighten evil, also guarded mothers and infants. Spells could be spoken, protective objects placed nearby, and divine stories reenacted around the laboring woman. Greek women called on Eileithyia or Artemis, while Romans appealed to Juno Lucina and other divine helpers. It is easy to laugh at magic from a room full of modern equipment, but ritual did three useful things even when no god intervened. It organized the helpers, gave fear a language, and told the mother that her community and its gods had not abandoned her. Ritual also marked the room as protected space, giving frightened relatives a useful role instead of leaving them helpless. Ancient childbirth was not medicine or magic. It was usually both, working side by side. When birth progressed normally, the midwife's job was to protect a process the body was already performing. She watched the contractions strengthen, checked what part of the baby was presenting, and avoided forcing delivery too early. As the head appeared, she supported the mother and controlled the final passage as carefully as her training allowed. Then came shoulders, the slippery newborn, and the first urgent question: was the baby breathing? The cord had to be tied and cut, the infant dried and assessed, and the placenta delivered without leaving tissue behind. A quiet baby might be rubbed, warmed, or stimulated while the attendants watched for movement and breath. Warmth mattered because newborns lose heat quickly. Feeding mattered too, although customs about when to begin breastfeeding varied, and wealthy households might employ a wet nurse. A successful birth, therefore, did not end with the first cry. Mother and baby still needed observation, food, warmth, rest, and luck through the vulnerable days that followed. Normal birth, however, is only half the story promised by the title. Survival was decided when normal became complicated. A baby might arrive feet first, lie sideways, be too large for the available space, or stop descending after the mother was exhausted. Experienced attendants tried changes of position and careful manual maneuvers, and Greco-Roman texts describe attempts to turn or extract a trapped fetus. Some methods were ingenious, others were desperate, traumatic, and used only when choices had nearly disappeared. Heavy bleeding could kill within hours. A retained placenta could keep the uterus from contracting, a seizure could arrive without warning, and infection might not announce itself until days later. Ancient surgery could not offer the rescue people now picture. Cutting open the abdomen was generally associated with a mother who was dead or beyond saving, not a routine path through obstructed labor. For a living woman in crisis, the available toolbox became frighteningly small. Three invisible enemies made that toolbox smaller: blood loss, infection, and the absence of safe surgery. A skilled midwife could recognize bleeding and apply pressure or other traditional measures, but she could not replace lost blood. That limit remained absolute. No matter how skilled she was, she could wash her hands and tools according to local custom, but she did not know germ theory, and a clean-looking hand could still carry deadly bacteria. She could identify an obstructed birth, but opening the abdomen without modern anesthesia, antisepsis, suturing, and transfusion created another catastrophe. Risk also changed with nutrition, disease, age, previous injuries, fetal position, and the number of pregnancies a woman endured. Reliable ancient statistics do not exist, so dramatic claims that a third or half of all women died giving birth should be treated with suspicion. Most women survived each delivery. The terror came from facing the risk repeatedly, knowing that one unlucky complication could overwhelm every skill in the room. So how did ancient women survive? First, most births completed without the rarest catastrophic complication. Second, women did not begin from zero every time. Communities stored experience inside people. Which positions eased labor? How to support a tired mother? What a normal presentation felt like when bleeding was becoming dangerous, and when a case was moving beyond ordinary help. Third, birth was a team event. One woman could hold the mother, another could prepare water and cloth, a midwife could concentrate on the baby, and someone else could summon additional help. Finally, luck remained brutally important. The knowledge was real, but its limits were real too. Much of that knowledge is now almost invisible because it was passed orally, practiced in private rooms, and recorded by men only when it entered medical or religious texts. A difficult lesson learned in one household could quietly improve the next birth across the village. The people who made birth possible often left no names behind. Ancient women did not survive childbirth because they were built to tolerate more pain, and they did not possess a lost miracle cure. They survived because the body usually succeeded, because experienced women learned to assist it, because families gathered supplies and strength around the mother, and because chance sometimes showed mercy. The midwife was not a modern obstetrician, but she was far more than a nervous neighbor holding a towel. She was the birth room's memory, its monitor, its coach, and often its best emergency plan. Modern medicine transformed the complications that experience alone could not defeat. Yet the oldest survival tool in childbirth has never disappeared: skilled human support. So the next time history describes an ancient mother as helpless, remember the circle of women standing beside her. Thanks for watching. If you enjoyed this journey into ancient life, please like the video and subscribe, because history has plenty more uncomfortable questions waiting for us.